Hi, my name is Travis with Congruency Therapy and Wellness, and this month, December, we are talking about the jaw, specifically TMJ, otherwise known as TMD, okay, more accurately known as TMD. TMJ is the temporomandibular joint. TMD is temporomandibular dysfunction. So this is when you actually have jaw pain. Everyone has a TMJ, all right, just to clear the air on that. Now, why in 2020 have I seen a significant uptick in jaw pain? All right, I'm going to give you three reasons that I think play into this. Number one is the most obvious. We've all started wearing masks, which I think is a great thing, all right? But wearing a mask puts pressure or puts a covering over your jaw, which makes our brain think, oh, I need to push back into that. So oftentimes people will actually push their jaw forward as they're talking into the mask. That, or they'll just naturally clench because they have that sensory input of the mask. Now, number two is stress, right? Everyone has had additional stressors on their plate this year, which that's something that I see regardless of the year, is that if someone comes in and has TMD, likely stress is playing some role, all right? And then number three is posture, all right? So if we have this forward head positioning, what this does is puts a lot of extra stress and tension into the jaw because it's all of these muscles behind the mandible, the jawbone, is kind of putting this passive tension on the jaw. Then we go to talk, we go to chew, we go to do extra things on top of that, which only increases these forces onto the jaw. Multiply all of these things over time, and we can force too much motion through an already very mobile joint, and this can lead to dysfunction. All right, so I'm speaking from experience here. This year has been a very stressful year for me. You know, I've left a city that I love, a job that I really loved, to start my own business, to fulfill this dream that I've had for a long time, which is increased stress, right? Posturally, I've spent a lot more time in front of the computer. I've taught myself how to use Adobe Illustrator and design my logo. I have built my website, which has just spent a lot of time in front of the computer. So now I can more so relate to my patients that spend just hours upon hours sitting in front of the computer. And then finally, mask wearing, right? So everyone has been wearing a mask, and this is another complaint or another common factor of jaw pain as far as what drives jaw pain, okay? So stick around. This month, I'm gonna specifically show you how I have almost completely managed my TMD, all right? I'm gonna show you how to do some self-mobilizations and work on some of the muscles that surround the jaw, show you how to assess the jaw, and also give you some exercises that you can do to manage your TMD yourself. So stick around. I look forward to it. It's going to be a fun month, and hopefully we're all going to have a bit less jaw pain at the end of it. Thanks.